Okay, so we're just going to go ahead and get started. If other people drop on, that's fine. Welcome everybody to our meeting. Wasn't expecting to do this via Zoom, but hey, we're making it work. For today, I'm just going to kind of give like really quick updates about meeting attendance, dean's reimbursement, honors cords, volunteering, a little bit about the elections, and then our guest speaker can present. So meeting attendance, we have a Google Doc link this time around since the campus CUSOTA is not having their meeting this month. If you are watching this at a later time, and for those of you that are on right now, please go to that link and just type in your name and answer the question. Meeting attendance for March 2020 is April 1st. As of right now, we still are scheduled for April 22nd. At 4 o'clock for our last meeting of the semester. I have to reach out to that speaker to see if she would be willing to do it via Zoom. So more to come on that. All of you know the AOTA Boston Conference was canceled. For those of you who were getting dean's reimbursement or were going to try to get dean's reimbursement, the campus CUSOTA team is still trying to figure out what they're going to do in terms of that. But on behalf of everybody on the CUSOTA team, we would just like to thank everybody for the volunteer hours that you have put in. It has not gone unnoticed. As far as I know, honors cords information is still the same. So class of 2020 and class of 2021, you just have to have 30 hours before you graduate. And then class of 2022 and beyond, you just must be a member in good standing for all 3 years, membership dues paid every year, attend 6 out of the 9 meetings every year, and then have the 30 hours of volunteering. As far as volunteering, all of the in-person volunteer opportunities have been canceled. For the unforeseen future. Megan reached out to me about possibly doing volunteer hours if you were to donate some money to Denver Food Bank or some other organizations. So I'm going to find out a little bit more information from her, reach out to the campus CUSOTA team and see if they would be okay with getting volunteers hours that way. That way we can still get some volunteer hours in. As far as the 2020-2021 CUSOTA exec elections, those are coming up really, really quick. I'm still waiting to hear back from one person that was nominated. Once I hear back from that person, I will be sending out a link via email so everybody can vote for the next exec team. And then once that survey has closed, Megan, Cam, and myself will be meeting with the new exec team to basically transition. Hopefully that'll happen sometime in April. And now I will hand it over to our guest speaker.
All right, I'll just share my screen. Okay. Is it sharing right now? For some reason,
Yes, it is.
Okay, awesome. I didn't see it for some reason. All right. So, as it said in your PowerPoint, my name's Catherine Carreno. I am from the campus pathway. I'm an OT3, so I actually had my DCE in Fort Collins at a place called My Heroes. So I think it's pretty well heard of, but it's a hippotherapy clinic in Fort Collins, and they're affiliated with CSU. But then I also did another part of my DCE with the Colorado OTAC, so Occupational Therapy Association of Colorado, and I learned about advocacy, and I kind of was able to pair the two together, and you'll hear more about that during my presentation. But I thought it'd be important to show you guys how to lobby for a cause, because I really didn't know the process of doing this before I started my DCE, and I was really interested in advocacy, so I wanted to learn how. So to start out, I just wanted to kind of give a general definition of what advocacy is. It's the public support for or recommendation for a particular cause or policy. It's really important, and someone that's an occupational therapist definitely needs to do it because it affects our scope of practice. It increases awareness of OT, and it can improve access to OT services. So the Occupational Therapy Practice Act was actually out for review in 2020, so it started in January, and I worked with OTAC on this. The Practice Act just kind of shows why OTs need to be licensed and why someone who isn't licensed shouldn't be able to do what OTs do. And it also updates the act of what OTs can do in the state of Colorado. So it happens every 7 years. So it's kind of like what has changed in OT over the last 7 years. And I'll talk about some of the changes that were made to the Practice Act. And then I wanted to tell you that like advocacy has to involve working with lobbyists and legislators. This was kind of a misconception I had, was that it didn't necessarily have to involve lobbyists and legislators. I had this misconception before Dr. Lohman's class, and I still have felt like some people have confusion around this. Like, for example, I feel like advocacy can be used as like, for example, using resources to get a patient a shower chair when they may not get a shower chair otherwise. Sometimes people say that's advocacy, but that's not actually advocacy. That's just like working for the better, like the good of your patient. So if you want to get involved in actual advocacy or policy, a good way to start is joining your state's occupational therapy association. So I'm not a Colorado native, but I started staying with a family friend in Colorado to do my DCE here. And so I joined OTAC. It's really easy. You just go to OTAC's website. And yep, so it was only about $25 for a student. And it's been really beneficial. They have a lot of webinars and virtual meetings, especially now with the COVID-19. I actually attended a webinar today about dealing with crisis, and there was a lot of talk about how OTs are gonna work through the pandemic and how they're gonna maintain their jobs, and a lot of the talk was about telehealth. So there's a lot of resources that are really beneficial by joining the state association. In addition, you can attend the legislative committee meetings. These are the first Thursday of every month, and they're from 5 to 7. At the beginning of these meetings, 2 lobbyists come and attend, and their names are Kathy and Steve, and I actually worked with them a lot. So what lobbyists are, they're people that are hired to persuade legislators about your ideals. So OTAC hires these 2 people, and they kind of keep us up to date and on bills that might be important to us. So a lot of healthcare bills they bring to our attention. We decide if we want to support them or not. And it's their full-time job, so they have really good connections with people in the House of Representatives and the Senate. So yeah, when I'm saying legislators, I mean House of Representative members and senators. And they also don't only work with OTAC, they're also employed by other organizations that want to get involved in legislature. And then I think a big thing is introducing yourself to OTAC's public policy chair. Her name's Bailey LaBeouf Johnson. She's actually my fieldwork educator for my advocacy part of my DCE. And she just has a lot of resources and is someone that's awesome to talk to you if you have any questions about policy or advocacy. And then a good way to really get your foot in the door of policy is just helping out with projects that legislative committee is working on, especially Hill Day. And I'll go further into that. So to really understand policy, I think it's important to attend Hill Day. You can do this at the state or federal level. I was working to get Hill Day set up, but it was canceled because of everything that's going on. But there's always next year. So if you wanted to get involved with that, you could. And then there's also the National Hill Day, and that's not yet scheduled, and it probably won't be scheduled for a while, just based on everything that's going on. This link that I have is a really good link if you were to decide to attend a Hill Day. Reviewing the link would be a good idea because it really gives you in-depth knowledge of what to expect. Oh, and then I was going to mention that a part of Hill Day is having to schedule the legislators that you want to talk to. So what I was able to do is I met with Kathy and Steve, who are the lobbyists for OTAC, and I went to the Capitol, and we looked at the House of Representatives, their schedules, and the senators' schedules, and we looked at if they could meet between 12:30 and 4 on April 1st. And then if they could, I went and I would go to their offices and meet with their aides, their legislative aides, and tell them what I wanted to do. I'd be like, I'm an OT or OTS, and I wanted to talk to you about occupational therapy and some of these bills that we support and why you should support us. And so I was able to get some legislators scheduled by talking to their aides, but obviously that was cut short. So we obviously don't need to schedule them anymore. The focus was going to be the celebration of the Practice Act because we did get it passed. And like I said earlier, I was going to tell you about some of the changes we made to the Practice Act. We talked about OTs being more involved in community health. So that was a change made. And then there are also changes so that we can more directly address mental health and OT services. We talked about how OT is becoming more evidence-based. And then in the Practice Act, there was kind of a discrepancy where it sounded as though the DCE was just for their clinical education. And so I actually testified at a public health care and human services committee. So that's just a committee that reviews bills. And so they review the OT bills because it's public health care. And I testified about how there needed to be an amendment to our Practice Act because DCEs are more than just clinical skills. We can go into including advocacy. I guess my internet connection is unstable. Including advocacy, research, and administration. I think there's about 8 areas, but I did end up listing them. So they were able to make that amendment. So DCEs are just not just clinical when you're doing them in Colorado. So that was awesome to kind of do something hands-on. So if you decide to participate in Hill Day, there's a bunch of different committees that you could be a part of. The Communication and Publicity Committee, you don't actually have to go to Hill Day to be a part of this. So you can help develop talking points, which is, I'm sure in Dr. Lohman's class you kind of learned about these, but it's just what you're trying to get across to the legislator, why they should support the bill, or what you're trying to gain from talking to them. And it should be in layman's terms because it's legislators that are reading it. And then you could also just help with communicating when Hill Day is and what it's about, and doing that through email, on social media, and the like. You could help with registration. So like when people who've signed up for Hill Day, such as OTs, OTAs, and students come to the Capitol, you can sign them in and you can get CEUs from doing Hill Day. So you can decide if they're gonna pay for a CEU or not. And then you place the members into advocacy groups or education groups. So advocacy groups are the groups of people that actually go and talk to the legislators. And then education groups are people that are interested in advocacy, but maybe not comfortable enough to go talk to legislators. So they might have a tour of the Capitol or listen to some speakers and still get their continuing education. So advocacy group leader is someone who knows the process of Hill Day a little bit better, and they are bringing groups to the senators or House of Representative members they might be meeting with. And they're preparing members of the group to talk about each point of the talking points. And the best strategy is to have people that are like directly affected by what you're talking about to speak. So if you're talking about mental health, for example, and why OTs need to be involved in mental health, it'd be awesome if you could find an OT or OTA who works in mental health and have them talk. And even better if they are a constituent of the legislator that you're talking to. That would be awesome because legislators work for their constituents, so whoever lives in the area that they're representing. So it's really motivating for them if they have someone talking to them who they are representing. And the advocacy groups, they meet with about 2 to 3 different legislators for a pretty short amount of time. So you can be a member of an advocacy group, so you'd be the one talking to the legislator, or you can be a member of the education group. I was planning on being an advocacy group leader, but obviously that did not happen. So additionally, you're expected to dress business casual and wear comfortable shoes because there's a lot of walking. Be prepared to go through metal detectors because that's just the nature of being in the Capitol and in the buildings that the legislators have their offices. So I would suggest keeping electronics to a minimum because you're gonna have to take them in and out of your bag a lot. Things at the Capitol run pretty slowly. When I testified, I think I was supposed to testify at 9 in the morning, and I didn't testify until 4 in the afternoon because of something they were debating, and it was being filibustered, and I don't know. So things do happen pretty slowly, so it wouldn't be uncommon if you would have to wait for a meeting, and just based on space, locations for meetings might be strange. They might not be actually in an office, but in a hallway instead. Meetings are usually only 15 to 20 minutes, so it's important to be clear and concise with what you're saying. And this isn't necessarily true at the state level, but I know at the federal level, oftentimes you're going to meet with the legislative aide and talk to them, and then they're going to relay it to their legislator just because the legislators are so busy. And legislative aides are typically like college students, so they are very useful, but it's still important to establish a solid relationship with them. We make sure that at the state level that we're actually getting to meet with the legislators. When I was scheduling them, I definitely made preference to the legislators that could actually meet. And it's obviously important to follow your advocacy group leaders' instructions. They know who co-sponsors or champions the bill. So if they co-sponsor the bill, they already know about it because they support it. And if they champion the bill, they definitely know about it because they're like the leader and they support it the most. So instead of wasting their time and your time re-explaining the bill to them, you can just thank them. So when you're meeting with a legislator, these are just the steps of what you can do. You want to introduce yourself and where you represent, and just ask them about their familiarity to OT, because as I'm sure a lot of you have experienced, not many people understand OT fully. And then you can ask them about if they know about what you're advocating for, the act or the bill. And when you're talking about the act or the bill, talk about if there are any other legislators who support it and if it's bipartisan or not, and any effects on the budget. It's really important to legislators if it has an effect on the budget. Money is very important to them. Also, of course, this is like true for any meeting. If you don't know the answer, just tell them you don't know, but you'll get back to them. And then you can close by thanking them for their time and seeing if they have any questions. It's a good idea to get a card for their contact information. This way you can answer any questions they may have had that you couldn't have answered and send a thank you and a follow-up. So since all of us are unable to attend Hill Day, what you can do is you can contact your legislator on your own time. I know your OTAC student representative, Heidi, she had a presentation about letter writing, to write letters to your legislators. So she has the same link of how to find your legislator. So you just type in the county that you're from and your legislator will pop up if you go to that link. You can also, instead of doing a letter, you can also do a phone call. Phone calls and letters are probably better than emailing. The thing about a phone call is that it's hard to ignore ringing, and it's pretty easy to ignore email. And it's a good idea before your phone call to write down your message and what you want to include in it. And you want to make it relevant to yourself personally, because if you're a constituent of this legislator, so like you live in the area they represent, they're going to be more interested in what you have to say. And if there's a busy signal, obviously call another time. It's totally fine to leave a voicemail. And if they pick up, it's probably going to be their administrative assistant or their legislative aide. So you just kind of follow the same template that I discussed in a effective meeting. And just be prepared to give your name and your address, because they will be interested in knowing if you're a constituent or not. So then I have some information here about the letter writing that Heidi went over. So if you just click the link, it's just a whole outline of how to write a letter, but I don't think my internet really likes me right now, so I'll let that load and we can always go back to it. And as I've already said, it's really important to relay all your information to your legislators' constituents, because that's why they're there. They're there to represent whoever lives in their district. So if you have your own idea of what to lobby for, and maybe OTAC isn't specifically lobbying for it, these are some questions that you should definitely ask yourself. So you should ask, is your idea cost effective? Because as I said earlier, that's very important to legislators. It takes a lot more to convince legislators of an idea that's going to be costly to them. Is there evidence supporting your idea? So I'll refer to scholarly journal articles. Wow. And is your idea within the OT scope of practice? So there was an OT who came to OTAC and he had an idea of doing dry needling as an OT, and OTAC didn't necessarily support his idea because, first of all, dry needling doesn't have that much evidence behind it. AOTA doesn't support it, so it's hard for a state organization to support something that the national organization doesn't support. And it's more dry needling is more commonly addressed by PTs, so it might be considered outside of OT's scope of practice. Even if OTAC doesn't agree with your idea for advocacy, that doesn't mean that you can't pursue it, and I'll talk about that in a later slide. But if your idea does check out all those questions, then you can start preparing your talking points. So this is kind of what I went through when I was thinking of my idea. I had to describe what I was advocating for. So I was advocating for hippotherapy, and I'll get more in depth because I have more slides coming up about it. And then why is hippotherapy important? And then what is preventing hippotherapy from happening? And since I'm going to present to the legislative committee, what does the legislative committee need to do after they hear my presentation? Like, what do I want from them? So if you decide to go the route that I've gone, you can contact your legislative committee, your state's legislative committee, and then find a time to present your talking points to them. And once they hear what you have to say, they may advise you to make some changes. They may agree with you and help you advocate for your idea, or they may reject your idea. So kind of to make this make more sense, it'd be important to understand the legislative process. So I am going to present my idea to OTAC on April 2nd, and let's say they agreed with my idea. So then there would be a bill draft. We'd have to draft a bill to make my idea cause some action legislatively. And then the bill would be introduced by a sponsor. So we'd have to find some legislator to sponsor the idea, and it'd get assigned a number. Then there'd be a committee hearing, like there'd probably be the Human Health and Services Committee that I had a testimony for. And the committee can either pass the bill on to another committee, pass the bill and place it on a consent calendar. So this is where non-controversial bills are just discussed further, or they can kill it, they can table it, or they can ignore it. So if it's killed, tabled, or ignored, it's kind of, well, if it's killed, it's over. If it's tabled, then you just kind of have to wait it out, and same with ignored. If it isn't killed, tabled, or ignored, there's a second reading by the whole chamber, and then it's considered on the floor and voted on by all members. So it starts in the House of Representatives. So all this is happening in the House of Representatives. So it faces debate when it's on the floor in the House of Representatives. Let's say it passes through the House of Representatives, the whole process needs to be repeated in the Senate. And if it also passes through the Senate, then it goes to the governor. And if the governor says it's okay, then it's passed and it's a bill. If the governor vetoes it, it goes back to the House and the Senate and is revoted. And if 2/3 of the House and the Senate say that they want the bill to happen, then the veto is overruled and it's still passed. So it's a lengthy process for sure. So as I mentioned earlier, if your state legislation, your state association doesn't agree with your idea, that doesn't mean that you can't advocate for it. I chose to advocate for what I'm doing through the state legislation because I'm new to advocacy and I'm also not a constituent. I'm not a Colorado resident. So what you could do is you could find other OTs that also feel strongly about the same issue that you're trying to advocate for and gather resources and information to build support, and then kind of take the same process, but you're just not going to have the state association helping you. And I just want to remind you that legislators work for you and are elected for you. So anything that you think that needs to be addressed in terms of like laws or acts, you can access them because that is their job. So now we'll talk about my idea. So I'm kind of going through the description of what I'm advocating for, why it's important, what's preventing it, and what does the legislative committee need to do. So hippotherapy is a tool and it's used in treatment of working with people with disabilities. So it's like the treatment of equine movement. There's a lot of evidence behind it, and I'll go more in depth in it because I'll pull up my talking points. And then there's a quote about why it's important from an SLP and a P2 who both use it. I'm not going to read it because you guys can read. And then the problem is right now, hippotherapy is excluded under Medicaid because there's a lot of misunderstanding about hippotherapy. It's considered a service and it's being coded fraudulently. I think it'd be better to pull up my talking points when we talk about that because it is kind of a complicated problem. But what the legislative committee could do, they would help me propose a bill to the House of Representatives to ask for the exclusion to be removed. So this actually happened in Oregon. Medicaid excluded hippotherapy, but they noticed that there was this problem and they did this in Oregon in 2016. I think there's 13 states without the hippotherapy exclusion. And what is trying to be done is each state is trying to get their exclusion removed. So, here's some of the supporting evidence. I also have this on my talking points. So I'll just go to the talking points that I have. If my mouse can be found, there it is. So you have to make sure the talking points are in layman's terms because it's going to be legislators reading it. You want to persuade the legislators to care and make it easy to skim because they're probably going to be skimming a lot of it, to be honest. So what I'm asking to be done is the exclusion, hippotherapy is an exclusion under Medicaid. I want that to be removed. So first is a description of what hippotherapy is. So I think it's important here that it's not a profession nor a separate service than standard therapy. Hippotherapy is just a tool, so it'd be similar to like using a therapy ball. And insurance cannot dictate if you use a therapy ball or not. So they should not be able to dictate if you use like equine movement as a therapy tool. So it's considered an exclusion because of this misunderstanding. In 2005, Blue Cross Blue Shield generated a commercial payer code apparently to monitor fraudulent billing of therapeutic horseback riding, which is an adaptive sport. So therapeutic horse riding instructors were billing insurance for therapy, which obviously isn't okay because they aren't licensed therapists and they're not providing therapy. So then there was an S code put on the code, and S denotes investigational, and anything that's considered investigational, Medicaid excludes and will not reimburse for it. This doesn't necessarily make sense though because healthcare does not have a standard for what constitutes as investigational. And equine movement as a treatment tool has more literature than many commonly accepted practice tools, such as a medicine ball, or a therapy ball. There's more research on equine movement than on therapy balls. So this code could be considered fraudulent because there's no therapy service called equine therapy or hippotherapy. There's no health professional called a hippotherapist. It's coded under a level 2 code, which therapy is only coded under level 1 code. Coding for a non-existent therapy would go against all therapy practice acts. And you might be double billing by coding and by pairing an S code with a standard like CPT code. Some private insurances will cover hippotherapy as a treatment tool, but a lot of them are covering it by covering the S code. So then a lot of clients who aren't covered have to pay out of pocket, and this leads to social disparities. So people that might benefit from hippotherapy, like people in Medicaid, might not be able to afford it because often people who receive Medicaid are of a lower SES. Hippotherapy doesn't add a cost to the healthcare system because it is just done in conjunction with other treatment codes and strategies, so it just fall within the regular fee structure and treatment codes. So like I mentioned earlier, medical necessity drives whether a patient receives therapy, not the treatment. Yeah, so then the rest of that is just evidence behind it in my sources. So then the next step would be proposing the bill like I suggested. So it is kind of a complicated problem, but it's very important because actually my fieldwork educator at my Heroes they're starting to have to build the S code, and she doesn't want to build the S code obviously because it's considered fraudulent and she doesn't want her license to be at risk. So she is waiting until something happens that they can start billing Medicaid or something that isn't fraudulent. All right. Yeah, these are my references. I got a lot of my references from AOTA's website. If you have any advocacy questions, that's a really good place to go. They have a lot of advocacy resources. And then let me know if you guys have any questions. I know the hippotherapy talking points are a little complicated. It's just like a really complicated problem. I talked to kind of like, she's like the guru of hippotherapy. I talked to her on the phone for like multiple hours about it. And then I'll stop sharing my screen.
All right, does anybody have any questions?
You may have said this in the beginning, so forgive me if you did, but what really ignited your passion for advocacy, and when did you just realize the importance of it and decide to kind of go that route with your DCE and just with your career in OT?
Good question. I really liked Dr. Lohman's policy class. I felt like it was a good way to make a change. So that definitely ignited it. And then I've always been interested in animal-assisted therapy, so I was starting to look into different sites that I could go work with animals and OT and kind of combine those. And I have been interested in insurance, which is kind of a strange thing to be interested in. But I just was like doing some research about animal-assisted therapy, and I saw that hippotherapy was an exclusion under Medicaid, and I was like, well, what is that? And I did some more digging, and it kind of came into that. And so the two kind of just really molded together well. And then actually being at the Capitol is really exciting. It's fun to like, I don't know, I've always kind of liked government aspects. I never wanted to be a lawyer or anything, but it is kind of cool to look into helping people understand OT that typically don't see it. Yeah. Yeah, I didn't mention that, so thanks.
Yeah, that's awesome. Thank you.
Mhm.
I know you mentioned that you're not from Colorado, so I was just kind of curious, like if you plan on carrying over this advocacy, like with hippotherapy and stuff, into your home state, or like why Colorado specifically?
So I'm from Iowa, and I feel like there's tons of people from Iowa that moved to Colorado because Colorado's really a cool place. So I had the idea of maybe getting a career in Colorado, but I looked at like the cost of living and just like the therapy jobs outlook. So I don't know if I'll necessarily work in Colorado. So that's why I decided to do my DCE in Colorado, because I was like, oh, it'd be awesome to stay there. I'm not necessarily planning on staying there, but I think I'm going to give my resources to my fieldwork educator at My Heroes, who's like having a lot of issues with the S code. And I'm going to let her, I'm like, obviously help her out along the way, but I won't be able to be there in person. And yeah, Iowa is probably where I'm going to end up, at least for a while. So Iowa, it's also an exclusion, so I could just continue this in Iowa as well. Yeah, but I won't necessarily be able to do it in Colorado, sadly.
No, thank you. Just like a fun fact, I'm a therapeutic riding instructor currently and really want to do hippotherapy when I graduate. So if there's any way I can continue to support this in Colorado, let me know.
Yeah, that'd be awesome. Actually, one of my projects is comparing therapeutic riding and hippotherapy, because there's a big confusion between the two.
Yeah.
But yeah, you can always email me. I think I sent the presentation to Kyra, so she can send it to you, and then my email's attached.
Okay. Thank you.
Yeah, thanks.
Any other questions? All right, well, thank you so very much for agreeing to Zoom with us and do our meeting. And I will send all the CUSOTA members your presentation and this recording, and we just really appreciate it.
Yeah, thank you. Would you send me the recording as well?
Yeah, of course.
All right, awesome. All right, well,
right.
thanks everyone for listening.
Yeah.
Thank you.
Thank you.
Thank you guys, and I will I'll send you guys an email probably either later tonight or tomorrow with everything.
Great.
So thanks
Sounds
for
good.
hopping on.
Thank
Thanks,
you,
Kira.